We're going to turn off the smooth sounds of Springsteen. We're going to get going. Welcome. We're so excited to have you here. Welcome everybody to our webinar series on AI. I am Katie Polson, a dental hygienist and product marketer for VideaHealth. The format of this webinar is going to be fireside chat style. We'll cover AI-aided diagnostics and patient care, the adoption of AI in a DSO, and the future of AI as it pertains to a chief dental officer. We have a few housekeeping items before we get started. First, this webinar is being recorded, and you'll be able to find it in the future on our website at VideaAI. There will also be about a 5-minute question and answer at the end. There is a Q&A button that you should see. You can submit your questions there to Dr. Scialabba. And also, as it pertains to the question and answer box, if you've got a question, maybe not for Dr. Scialabba, but more as it pertains to AI in general or VideaHealth or and anything like that, we do have team members manning the chat, so feel free to ask questions there. All right, I'm going to stop my sharing here because we are going to do a quick poll before we get started of 2 questions. The first question is, we want to know what your role is, this is mainly for Dr. Scialabba, what your role is in the practice so he knows who he's talking to. So first, let's take 2 seconds and please vote there. Let us know. All right. Caesar, where do we find the oh, there we go. Cool. That's awesome. All right, DSO leader, dentist. No, hygienist. Maybe they'll come. Just kidding. All right, and then the next one, next question we've got is, what is your familiarity with AI? We'll pop that one up here just so we have an idea of how basic and how in depth we need to get going on these questions. Okay, I think we've given people enough time.
Okay.
Oh, that's good. Awesome. Somewhere in the middle, and a few that are really familiar. Awesome. So glad to have you guys. Okay, that's awesome. Well, let's just kick into it. So I'm going to introduce our esteemed guest, Dr. Micah Scialabba. Michael Scialabba, GDS. He's a Chief Clinical Officer of 42 North Dental, at the leading dental service organization in New England. In this role, Dr. Scialabba oversees the clinical excellence of 330 dentists and specialists operating across 110 locations and 37 brands across 9 states. Dr. Scialabba also serves as a gubernatorial appointee of the Board of Registration in Dentistry, and he has been the chairman of the board since January 2021. He is a member of the Commission of Dental Competency Assessment and is an examiner for the American Board of Dental Examiners. This past year, he participated on the curriculum committee for the annual ADSO Summit, and Dr. Scialabba continues to practice at Great Hill Dental Partners in Peabody, Massachusetts, where he has cared for his patients for the past 15 years. We are so lucky to have you here. Thank you so much for joining us.
Thank you, Katie. I'm the lucky one, being able to have VideaAI in our practices. It's been a game changer, and to have be able to work with the team that you have at your organizations has been absolutely tremendous.
Well, thanks. We feel equally as grateful. So let's get going.
Yeah.
First of all, we're going to start with the diagnostic and case acceptance because that seems to be a pretty interesting topic for a lot of people and what they want to know about. And I want to start with something, a Dental Products Report article that I had read that you were quoted in. And you said that AI calibrates the care received in an office. It removes any personal bias for the provider and in turn provides transparent, objective findings to the patient. Could you expand on that, and how have you seen transparency applied to dental diagnostics and change with AI amongst your supported dentists at 42 North Dental?
Yeah, I think dentistry starts with the diagnostic process. We gather information, whether it be looking at radiographs, doing a clinical exam, taking photographs, and start to formulate our plan of treatment for that individual. Depending upon the skill set of an experience level of every provider, that treatment plan may differ dramatically for a patient. And when you have a large number of doctors, you start to see the discrepancies and opportunities to calibrate. And what VideaAI is able to do is it creates a level playing field for the patient. It takes away that experience level needed to diagnose certain things like decay, periapical lucencies, bone loss, and starts to basically pull all the things that we want to look at together into a more manageable discussion for the patient. And what I mean by that is it doesn't work on its own. The AI needs a partner, and that partner is the doctor to approve what the findings are. And the AI allows us to concentrate our time on what the computer is identifying as areas of concern. And that's the way I teach our teams. And being able to have that level playing field allows a patient who might see a new graduate and might see someone who's got 20 years experience have the same diagnostics. Now, the treatment plan and actual treatment may vary depending upon the skill set of the provider, may vary based upon the confidence of the provider, but this is where AI is so integral. It helps accelerate that confidence level for that provider. Depending upon the provider's experience, depending upon their day, how busy they are, working out of different rooms, they have their hygienist to work with. We are busy. We sometimes, I hate to say it, judge a book by its cover, and we might see a healthy patient, but their mouth isn't healthy. We see a visual healthy patient, but we don't know until we actually do the exam. And sometimes when you're rushing, you don't concentrate, and not something that we don't want to happen. It just happens. We miss things. We don't want to, but we do. Sometimes we think different socioeconomic groups are more prone to having certain types of restorations than others. And when we don't basically, when we eliminate those biases, we get a more true understanding of the patient's health and can then communicate that to the patient and deliver a more trusting environment. The AI works as a third party, I'll call it validation of what the findings are. And we believe in what I call co-diagnosis. And when you have co-diagnosis, where you just put all the information on the screen and ask the patient what they see, when the AI is up there, they're asking those questions. So like, well, what does that mean? What does this mean? And they start to take ownership of their their health. And that helps build trust and facilitates the treatment planning and treatment plan acceptance. So when I talk about calibration, it's getting everybody on the same playing field, that no matter what the way the patient presents, that they're getting the same level of care. We're setting that standard.
That's really great. I love what you said there about like having everybody be on the same page, same standard of care. It really, that's what we've seen with other providers. It really does. Patient education becomes a whole nother thing. And also you said something, the co-diagnosis. And when you said that initially, I thought you meant like co-diagnosis with you and the AI, but you're talking about co-diagnosis with you and the patient.
I think cool. you can use it for both, but I think the co-diagnosis with the doctor and the patient, letting the patient really take ownership of what their disease process is. We forget that decay is the #1 disease in the world. It's the most prevalent disease in the world. And why we poo-poo that, I don't know. And the AI is just reestablishes that there's a lot of decay in this world. There's a lot of cavitation of tooth structure that we need to treat. I know you have a lot of questions, and I have a lot of things I want to talk about when it comes to what the AI allows us to do. But one of the things I know that happens with the presentation of the AI is it identifies things we or I can't physically see with my own eyes. So you start to question, well, there's something going on here. And I think that when you start to see, we used to call it incipient lesions. Like, is it there? Is it not there? Do I treat it? Do I not treat it? Oh, I'm not going to treat it. Well, guess what? When you don't treat things, they don't get better on their own. And they're only going to progress and get worse. AI is giving us the ability with some newer technologies like Curidon, um, which is a remineralization product. It's a peptide bond that grabs the calcium that will remineralize the tooth structure to start to really practice minimally invasive care. Start to really put our mouth or the money where our mouth is and do preventative dentistry. And really, I think can be a game changer in the dynamics of payer models and also, delivery of care. I really do. I think that it's going to take decades and time to occur, but this is the first product to help accelerate the treatment of patients. We have historically waited to let things get bad. And if you let the tooth get so much decay that it's actually painful for the patient, we've already lost that tooth. That tooth will not have a longevity of being in that patient's mouth for their lifetime.
Yeah.
There will be, you put a really large restoration in, or you go right to a root canal. That root canal is a crown, has a life expectancy after that point in time. And after that, taking the tooth out, placing an implant. So it's going to take years for us to eradicate decay, but this is going to accelerate the process of treatment, which keeps patients healthier longer.
Yeah. Yeah, I love that. And we'll have you on again for when we're talking about minimally invasive dentistry, because I know that's a passion of yours. And that's definitely where we see there's a lot of areas where AI could be helpful, but we definitely think that is for sure one of them. And hopefully where we can help take part in bringing patient care earlier. And things. I mean, my dad was a dentist, and everyone, this is a known saying, right? Like the best dentistry is no dentistry, or the least amount of dentistry. It really is a super important thing that I hope that we get to be a part of. Yeah. Awesome. Well, we are just along those lines of patient care. I want to know, as you have adopted AI at 42 North Dental supported practices and have had an opportunity in your own practice and helping support your 330 plus dentists and specialists, how have you seen the patient reaction to AI in these practices?
Yeah, it's a great question. Our patients have been blown away that we have the technology available. You're always going to get someone who's resistant, and that happens in 1 out of every 100 patients that says, I don't want Big Brother telling me what's going on. But for the most part, the 99 other patients are super excited that we're investing in their health to improve their health. The enhanced transparency. Patients, will always do dentistry when they're in pain. When they have something that's painful, they want to alleviate that pain. They will do all the dentistry in the world. They'll take a tooth out, do a root canal. I've had patients tell me take the tooth out, and we can't identify what tooth is causing the pain, and or if there's even a problem with that tooth. And if you do proper diagnostics, sometimes you can prove it's not the tooth causing them pain. It might be a sinus infection. One time I was having a patient who was actually having a stroke in a chair. And, we basically said, we're not taking this tooth out. We're going to send you to the emergency room. And what the AI does is help build trust. And when the patients see that, and they see that you're trying to aid in improving their health, they're not only very receptive, it has created opportunities for them to tell friends and family and refer new patients to our practice. Because we're excited to promote that we are an AI aided practice. You can't use AI on its own. I want to reiterate that. The AI needs to work together with the doctor. The doctor, the hygienist, the team works together in utilizing the AI as a tool. There are a lot of other things of AI that's being utilized in your practice, whether you know it or not. And it may not have the word AI in it, but there's AI in a lot of things that we use every day. Most of our laboratories are using AI to design crowns. So just because we don't promote it with the word AI in it doesn't mean that it's not happening. And I think that what's really unique is that it's time to basically not hide that fact anymore and just tell the patients what we're doing and why we're doing it. And at the end of the day, the dentistry would be a lot more, it's expensive to begin with. It would be a lot more expensive if AI wasn't here. If we weren't using AI guided design for crown, AI designed stuff with Invisalign or aligner therapy, some of those things would be a lot more expensive than they are, and it would be less affordable. So I think AI has accelerated the number of people that can be treated as well.
Yeah, that's really cool that you've seen in your supportive practices that it's drawing people to the practice and making them want to choose 42 North dental practice for their treatment.
We're lucky enough where we beta tested AI for a year before we rolled it out for all of our practices. And in that time, we started to have, patients ask for it. Do you have this in my other practice, in another practice? And we told them not yet. So, being able to build up that momentum and having doctors ask, it's working in their practices. When can I have it? And then when you start to promote it, it created a lot of momentum. Like, hey, why do they have it and not me? So when we rolled it out, there was a lot of excitement, and the patients were communicated to in a way that, hey, we're going to look at we're going to help, the computer's going to help aid us in identifying areas of concern, and then we'll look at it together. And listen, nothing's perfect. And when I say that is the human eye isn't perfect. We're not perfect. This helps us reduce error. So not only is it getting us better outcomes, faster outcomes, it's reducing error, human error. And it's like reducing the amount of times we miss things and or misdiagnose. So all those things are good together.
Yeah. That's really cool. So I want to spend a little bit of time with those that might have adopted another AI, or they're using AI. We have a few that are using it. One thing that we've had the pleasure of watching 42 North adopt AI is how well they've been able to manage it. Not that it's difficult to adopt, but it's just anytime you implement a new system into a practice and then you do that at scale like you have, there's questions on adoption. So I'd love to know what, first of all, before I would love for you to just briefly share, and this is not something we went over, but I think you can do it really eloquently, is how did you choose AI? What drove you to adopting AI, and why did you want to do it? And then when you did adopt it, what went better than expected with your deployment, and what surprised you? Maybe
Yeah, those are great questions. I would say what initiated the discussion is at 42 North, we have a clinical culture that's driven by our doctors. We mentioned earlier, we have 330 doctors. We have 300 hygienists that utilize this product. It came from discussions with them of how do we push forward our objective of quality, safety, and efficiency. And partnering with an AI company, when we first started to roll out that strategy of really driving, how do we start to measure quality and improve it? How do we look at efficiency, and how do we look at safety and start to put KPIs on it? We started to say, what are the things that we have to do to take the next step and do what nobody else is doing? There's a story, Marco Vuvacek of the ADA, who's the chief economist of the ADA, has a lecture he's done numerous times, and it's basically he mimics Wayne Gretzky, and he says, go where the puck is going and not where it's been. And if you're a hockey fan, you understand that. And if you're not, just break it down really simple, is if you do what everybody else is doing and you just keep doing what you've always done in the past, you're not going to score a goal. The puck's going to be behind you or too far in front of you when it's time to get your shot. So we wanted to basically do what a lot of people weren't doing. So we said, let's really dive into new opportunities and new things that people are like, we hear about it. And we were small enough and nimble enough to say, let's go all in and really learn about AI and test it out. And we saw some great results. We saw the results that really were, what really attracted the doctors is we saw an increase in treatment plan value when utilizing the AI versus not using AI in a practice. So that increase in treatment plan value said we were absolutely missing opportunities without the AI. We also had VideaAI put together a test they used for the FDA clearance of showing doctors 100 radiographs and randomly, and we had our doctors look at those radiographs, identify decay, or maybe there was no decay, and then looked at another 100 radiographs, the same radiographs with the AI, and we found our doctors were actually tested better than what the FDA studies showed. So we were really proud of that. But we still found about 17% of an opportunity with the AI versus the missing without having the AI. So having that with our own doctors testing those things really created momentum to say, you know what, we as a group, we feel we're pretty good, because I think that Florian said there was like a 31% increase in decay identification, but we were about half of that. But we still found that our doctors could be better with using AI. And the doctors admitted to that, saying, wow, I missed that something. It happened to me. You know, I've practiced for 20 years. I think I ran a pretty darn good practice, but I've missed decay. And if a doctor can't admit that, they haven't practiced dentistry. So when a patient came back and I looked at the tooth and said, crap, when did we miss this? And I look back at the films and I'm like, you know what? I totally missed this. And I basically took ownership of it and told the patient, listen, we'll take care of it. There's no cost to you. The AI would have helped me in that first appointment with that patient, and we wouldn't have missed the decay.
Yeah.
So I think part of the success is having a team of providers who are humble enough to basically say, I want to get better and I can't do it on my own. And this is something to help me accelerate the improvement and improving quality. So because we had that initiative of quality, safety, and efficiency, in conjunction with trying to do things to aid our doctors to get better, the doctors being open because we showed them the test results of how they themselves tested better using AI, it was very well received. Now, does every doctor accept it? And does every doctor want to use it? The answer is no. But I tell the doctor, it's not for you. You don't need the AI. The patient needs the AI. And we have an obligation to offer it to the patient. And that argument is where it changes. Because anyone who's objecting to that, to using the AI, then realizes that if our goal is to improve patient care and improve patient outcomes, it doesn't matter what I see. It matters what we see together.
Yeah.
And that's why it's FDA. That's why there's FDA approval. That's why VideaAI has the highest, the most approvals from the FDA for utilization, because that's the approach that they take. And when I met with all different vendors, that was the connection that I had and where I wanted to take the utilization of our product. And what I really believed was Florian, who's the CEO of VideaAI, and his team had the same belief. And because our goals were so aligned, it made so sense to partner together to make this happen.
Yeah. That I actually did not know that internal study that you had set, and 17% for, you know, sometimes metrics get thrown in the air and it's like, it's not 80%, then why do I adopt it? But
exactly
70% is a big deal in the fact that that's a couple incipient lesions treated with some sort of medicament beforehand is worth catching it early.
Absolutely. We're improving lives, you know, and I think that the stratification of our doctor group, we have, you know, 300 doctors. When you start to look at, not all 330 doctors took the test, but the group that did, there was a stratification of experience. And there's no doubt that the younger provider, the less experienced, was aided by the AI more than someone who had a lot of experience. But at the same time, somebody who had, like, I would say beyond a certain amount of experience also was aided by it. So the correlation is almost like a bell curve, like you would have, okay? Yeah. And if we can move that bell curve up and to the right, where there's less errors, there's better care, there's more accurate care, and we treat the patient sooner, it's a win-win for everybody. And that's exactly what we're trying to do. Yeah. So.
Well, this has just been super enlightening and went wicked fast for you Boston people. That was really dorky, sorry. I have a few questions, so a few really good questions, and we've kind of already alluded to an answer, but I think it's good to get in depth because this is something that we had talked about before we even hopped onto this webinar, which is one of the questions is, how are you dealing with encouraging doctors who think they are better than the AI? And I would add, like, doctors who you alluded that don't want to use it, they don't think that they need it, and expand
Yeah,
on that, because I think you've already touched on it a little bit, but give us a
yeah.
little bit.
So I think with our team, you we're working with one of our offices. We are trying to set a standard of care, and that standard of care is multifaceted in lots of different ways. We believe in multi-specialty group practice. Okay, we have plenty of GPs who want to place their own implants, but if they have an oral surgeon in their practice, they're probably not going to be placing implants. But we have we have GPs that do place implants in potential areas where they don't have a surgeon or a periodontist. So it's the same concept. It's like the AI may not be for you, but it's for the patients. You can't go ahead and treat patients without offering implants as the solution, whether you place them or not. So having the AI and having a conversation with the providers who are resistant is really important, because McDonald's doesn't, advertise a Big Mac with sesame seed. I'm going to say it incorrectly, but they don't offer a Big Mac without putting the special sauce on the burger, right? You can't advertise that you're going to give patients the opportunity to be diagnosed with AI without offering it. So it's one of those things where everybody gets on board because it's a team effort, team sport. The hygienists love it because it helps identify opportunities for perio treatment, because you're looking at bone loss in a different light. And it's, very visible identification of bone loss per tooth. So there's opportunities to have a conversation. And what I found is when you don't want to have that conversation with that provider who doesn't want to use it, and you say you to let them be, is where things go south. Mm-hmm. And you say, listen, you don't need it. And I'm not saying you need it. The patient is the one who needs it and needs to benefit from it. So put together your treatment plan, check the AI. And what's great about the AI is it's constantly learning. So if there's something that you disagree with, that you don't want to treat, and I'll use minimally invasive care. There are some people who are still learning about minimally invasive care with Curidon. If you don't see the incipient lesion that it identifies and you don't want to treat it, you don't need to. Okay, the AI is not doing the dentistry. The AI does not have a license. The AI is guiding you to look at the x-ray more closely. Mm-hmm. Don't share the AI findings with the patient until you review them yourselves.
Yeah.
Okay, so review the films yourself. You agree, disagree with the findings, then put the screen up with the patient and say, hey, this is what the AI found.
That was another question, which is, does the AI ever show incorrect results?
Yeah.
And comfortable situations for the patient.
Yeah. So listen, I would say that the AI is constantly learning, but it's learning from what we're telling it to learn. So could there be something, have I had a doctor in my 110 offices or so tell me, hey, the AI found something that I didn't see, or the AI missed something that I see? Mm-hmm. I'm going to say, yes, it's happened. Okay. But that's where we need to work together with our developers to identify these specific areas and say, hey, why didn't it pick up this situation? It might have been a bad x-ray. It might have been an x-ray that wasn't diagnostic. And the computer said, I can't read this because of overlap. Now our human eyes have adjusted to identify things, to say, this isn't overlap, this isn't burnout. I'm going to, still treat this the way it is, and I'll deal with the bad x-ray. So there's things that the computer is doing to help us raise our level of care by making us make sure that we have good quality x-rays to take. So the answer to the question is, are there errors? Yes, but that's why I say review the findings before you go in and talk to the patient about the care. And overall, the amount of errors for the number of x-rays that we've taken in the last year I can count on a single hand. So it's very minimal.
I would also add to that, and just that sometimes if you don't feel like the AI is for you, it's also could be for your team member as a hygienist.
Absolutely.
Be able to have that communication and have a better support and confidence in knowing what to have and to tee up the patient before the doctor comes in it's invaluable. So it's not only just for the dentist, it's for the team as well. So really awesome. Well, it's let me just scroll through just to make sure. It looks like I have a few questions about showing a demo, which is, I love that you want to see AI in real life. We've got a few team members that are happy to do that for you and make it specific to your practice or your DSO. So we will make sure that you can have an opportunity to do that. One of the questions was on workflow, which you've already suggested there. And I think that's it there. Let's see, if you did ask a question and it didn't get answered, we'll look for your email through your email, and we'll answer it there. But anyway, Dr. Scialabba, thank you so much for joining. Honestly, it's been such a treat for us. We do have, if you do want, for those of you that are customers, awesome. Thank you so much for joining. We hope you got a lot of it. If you aren't and want to see how AI can specifically help your DSO or your practice, there will pop up a poll here. You can fill that out or click the QR code, or even just put your name in the chat. We're happy to reach out to you and get you more information on that.
Katie, thank you so much for having me. Yeah, whatever I can do to help.
Yeah, it's been a pleasure, and it's been so fun for us to see 42 North from the adoption from the start to where it is now. You guys can look for more webinar series like this in the future on different topics, on problems that AI is solving in dentistry. And I'll leave this up for a couple more minutes and we'll hop off.
Yeah. Thank you, Katie. Thank you, Caesar.
Thanks. You can hop off, Dr. Scialabba. I'm just leaving this up for just a minute more.
We'll see you guys soon.
Bye. Thanks.